Examine the foramina of the middle cranial fossa, which lies between the lesser wings of the sphenoid and the petrous ridges of the temporal bones. Re-identify the anterior clinoid processes and the sella turcica. Medial to the anterior clinoid process is the optic canal, through which passes the optic nerve, cranial nerve 2, and the ophthalmic artery. Beneath the lesser wing, between it and the greater wing, is the superior orbital fissure. This fissure transmits the superior ophthalmic vein, cranial nerves 3, 4, 6, and the frontal nasociliary and lacrimal branches of the ophthalmic nerve, which is the first division of the trigeminal nerve. Just below the superior orbital fissure is the foramen rotundum, which transmits the maxillary nerve, the second division of the trigeminal, to the pterygopalatine fossa. Posterior to the foramen rotundum is the foramen ovale, which transmits the mandibular nerve, the third division of the trigeminal, and the lesser petrosal nerve. Just posterior and lateral to the foramen ovale is the foramen spinosum, through which pass the middle meningeal vessels. The groove for these vessels can be seen along the wall of the middle cranial fossa. If you place a thread in the foramen ovale and the foramen spinosum, the threads can be seen emerging from these foramina on the base of the skull. Medial to the foramen ovale and the foramen spinosum is the foramen lacerum, which is closed by fibrocartilage in the adult. Adjacent to the foramen lacerum is the opening of the carotid canal. With the use of a thread to mimic the position of the emerging internal carotid artery and associated internal carotid plexus, it can be seen that the internal carotid passes over the foramen lacerum. Trace the thread passing through the carotid canal and above the foramen lacerum to reach the inside of the skull.